And joining us now is Dr. Stephanie Widmer with more on how to stay healthy. Doctor, good morning to you. It's great to have you.
Thank you guys for having me. So I guess let's talk about these viral syndromes.
And I want to jump right into some of the numbers here as we get into it, because the flu, COVID, RSV, norovirus making the rounds this winter. RSV cases higher than they were this time of year last year. 35 states reporting high or very high levels of respiratory illness. And the CDC estimates that there have been at least 5.3 million illnesses, 63,000 hospitalizations, and 2,700 deaths from the flu so far this season. So we just mentioned earlier, people calling this a quad-demic. Is that really an accurate description? And how would you explain what's really going on?
So this term quad-demic, it refers to the convergence of high levels of, just like you said, flu, COVID, RSV, and this norovirus. And there are multiple factors at play here. Different social, environmental, biologic factors that are causing these numbers that, in New York, it's not unprecedented to see high levels of viral syndromes, especially during the winter when there's indoor crowding, increased travel, lots of different gatherings. But there are other factors at play here, such as viral evolution, new strains that emerge, lots of different things.
Doctor, how do we know what we have? Because so many of these symptoms can be so similar.
So that's completely true. So fever, chills, headache, body aches, fatigue, things like that are pretty much across the board with different viral syndromes. Norovirus is a little bit different, on the other hand. That presents primarily with GI symptoms, vomiting, diarrhea, abdominal pain, aches, things like that. But that's not necessarily unique to norovirus. You can have some overlap with the flu. So based on symptoms alone, it's not always entirely possible to tell which viral syndrome you have.
Wow. Doctor, when we pulled up the first map that showed where in the country there was very high or just high, I was struck by right here, the areas where it's very high, it's not just in one concentrated area. Can you explain what may be causing where we're seeing those spikes? Is it just population? And then what are best remedies? When should you go to the emergency room?
Sure. So like I said, it depends. Different outbreaks happen for different reasons, indoor crowding, different strains, different things that are going on in the community. But pretty much across the board, the way we care for these viral syndromes is what we call conservative management and supportive care. So getting enough rest, staying adequately hydrated, taking over-the-counter medications, fever relievers, pain reducers, acetaminophen and ibuprofen, things like that, kind of letting the virus run its course. The good news is that these symptoms pretty much tend to resolve themselves spontaneously. But when you're experiencing things like shortness of breath, difficulty breathing, if you're unable to walk or care for yourself, and if you're unable to eat or tolerate anything by mouth, and you're not able to drink water, that's a pretty good time to go to the emergency department for an evaluation.
So you mentioned some of the remedies there, but what about prevention?
So prevention is key. One thing that's very important, if you haven't gotten your flu vaccine or any other vaccines you might be eligible for, it is not too late. So reach out to your healthcare provider to see which vaccines you can be eligible for. Hand washing is huge, especially with this norovirus. So hand sanitizer may not be 100% effective for norovirus. So washing your hands at least for
key to remember
20 seconds. Yes, because a lot of these viruses can live on surfaces. So washing your hands adequately, not touching your face, your nose, your mouth, things like that are huge for prevention.
Dr. Stephanie Widmer, thank you so much for being here. Really good advice.
Thank you.
We appreciate you.